Back to EKGs. Let's not give away the farm. We're going to have it all in. All right? Now, there you go. So if you can, you want to get on the telemetry unit. Being real with you as nurses, the other part of being on a telemetry unit or any unit with extra skills is the more skills you can learn, the better you will become as a nurse. Another thing I need you to do as soon as you hit the floor running, look for something called shared governance in your hospital or your facility. It is where you become part of the decision-making process for what happens to your practice on the unit. It's called shared governance. Magnet hospitals have it. It is critical that you become part and parcel to the table, because if we're not a part of the table, we become the fucking table. Okay, so you need to be at the table where decisions are made. Your hospital will have a town hall meeting. You take your ass to those meetings every time they have them. I take mine, I go right down there with the head of the whole entire Cleveland Clinic enterprise. I shake his hand, I make sure you know who I am, because I'm just as important. Okay, so now back to the lecture at hand. That was on the song. Okay, all right, now telemetry versus EKG, ECG. This, I want you to put on that page that you're on, that little sample EKG. I want you to put, this is continuous heart monitoring. For high risk. Okay, that's what I want you to know about telemetry. It's continuous heart monitoring for the high-risk cardiac patient, or I wouldn't say cardiac patient, I would say high-risk admission. So your patient's admitted for something completely unrelated. Pancreatitis, CHF, COPD, kidney failure, what are the different things I get on my unit? Amputations, DKA, all kind of crazy stuff. Well, so it turns out that they actually also have a heart problem. That's where this comes in. Okay, so instead of admitting them to the hospital, we are going to take in consideration, we can't just throw them on any unit. We need to throw them on a unit where the nurses are smart and wise about cardiac. We need to throw them on a unit where the nurses recognize V-FIB. We need to throw them on a unit where the nurses can pick up on that VTAC immediately. Okay, that's you nurses, that tele-nurse. Okay, so that's important. Now, you need to remember, the telemetry does not diagnose anything. As a matter of fact, if you pick up on a problem, now you need an EKG. So the EKG is a right now diagnostic tool, especially when telemetry picks up on something that may not be right. This will not diagnose. This will. So one thing I noticed a long time ago with nurses is they were confusing these two. Yeah, they're not the same. Okay, so they're not the same. No way in hell are you going to have a continuous EKG. What you're going to have is telemetry. Okay. Now, that being said, there's a certain kind of rhythm and rate that we look at on the EKG that's super duper easy. What I do with every packet, even the ones that many of you did purchase, I make sure that you understand with these different packets, the front page is part of the test. Okay, no front page is just a front page. Something on that front page is part of the test. So in this case, when you look at this front page, I chose to use this front page to prioritize certain things and put it in order of who's going to die first. And then I also gave you at the very bottom the coolest example of how to label your EKG. So we're going to do a lot of labeling. You were good babies. You brought your little highlighters, and hopefully you have your colored pens. Now remember, on Sunday, every time we do boot camp, we give away the farm. So somebody's going to get all the note cards they ever could want. They're going to get big highlighters. They're going to get colored pens. They're going to get the tiny highlighters. They're going to get the 5-subject notebook, and they're going to get a free class. So you know that we're serious about our trade, because what we're trying to give you is everything I told you to get. So your supplies when you leave here are very important. But if you're smart, you have some colored pens or some highlighters, and you're going to be able to roll with us as we label our strip. Now, when we start, this very first thing that we do on the strip is we literally try to figure out the heart rate. And I'll tell you like this. When you look at this, you can see that you got to know your alphabet. If you come up out of here out of first grade and don't know this alphabet, it's going to be a problem. So remember how the letters have to go. It has to be a P. Y'all see it? Yes. Q, R, S, T. Your job is never put them out of order. Ain't that right, y'all? Okay, so it's got to be a P, Q, R, S, T, or forget it. Now, so you can see that the P wave is atrial. The Q, the R, the S says QRS complex. If you look at the bottom of the S, it's ventricle. And then the T is more ventricle. Let's talk about that. We shouldn't assume that the babies know. When we're talking about atria and ventricle, which part of the heart is bigger? Yes, the ventricle. That's going to be your guide. That means when you look at this EKG, the big part of it is all ventricular activity. So you see the biggest part of any EKG is the big spiky thing in the middle called a QRS. That is your ventricle, the big part of the heart contracting. It's the biggest part of an EKG strip. But you don't want to ignore what had to come first, because as you know, the ventricles are at the bottom of the heart. And in order for them to contract, didn't the top part of the heart need to contract first? And that's called your atria. So that means if your top part of your heart had to contract first before the bottom part could contract, then the top part of your heart should come first in the EKG. So one of the first things we do is find the first part of the heart action. And the first part of the heart action is the P wave. So this P wave is a tiny little hill. Why is it so tiny? Because the atria are smaller, right? So they're not going to have a big dramatic hill. They're going to have a nice small hill, but it has to come, and here's the deal, it has to come before the ventricular activity. So it is a very, very easy way to see what? If you have atrial and ventricular activity. If you've got both of those, well, then that's a very good start on a good heart. Uh-oh. If we have none of them, then what parts of the heart aren't working? The atria or the ventricle. But Shelly, doesn't that mean they're dead? Fuck yeah. Let's go find that strip. So you're going to open your packet, and you're going to open it past this page, past that page, to the very first set of strips. The numbers are in the right side of the margin. Do you see the numbers? Yes. Now, I tell you, this exercise is so fun and easy. You're going to be able to find it really quickly. So, girls, what you think about strip 1? We got atria and ventricular activity, don't we? It's so easy to see. What about strip 2? You got ventricular activity with no problem at all. Your atria looks shady, but I said neither one, but you see one at least. Y'all with me? What about 3? Is that our strip with no ventricular or atrial activity? No. What about 4? No. What about 5? No. What about 6? I don't know about you, but I do not see the big, huge spike that represents ventricular activity. And in addition to that, I don't see before the spike that ain't even there, the little bitty hill that comes before it. You see that? This person has no ventricular activity and no atrial activity, so they have no pulse. This is V-FIB. This is how V-FIB will look. Little baby, you need some handouts. Come on up here, honey, if you don't have none on that table back there. And get this. So let's do that again. Go to your teacher strip. Remember, you got to go to the original strip. And when you go to the original practice strip, you don't see nothing like that, do y'all? And you keep your finger in there though, right? You keep your finger on the practice strip because we're going to go back and forth. That is so organized when you look at this strip. There is absolutely no organization here. It's just squiggly, diggly, biggly, boo. I could have just went just like this, y'all. Watch this. I could have did just like this. Not look and, you know, just whatever. And that's the same exact thing you see. No QRS, no P wave, no heart rate, no pulse. Ooh, well, that's V-FIB, okay? So that's how easy this is about to be, the way you just chose that right away, okay? All right. Now, so that's the easiest strip. What is hard on NCLEX is not recognizing this strip. You do pretty good. What's hard on NCLEX is wondering what you should do about it. Oh, so let's see what you want to do about it. Your first nursing action when you walk in, and listen to my question because that's where the answer is, right? When you walk in the room and the patient is in V-FIB, what is your first nursing action? I'm coming to you first, baby. What do you want to do first?
Check the heart.
Check the heart?
Same thing, EKG or call for a code.
This is an EKG. I just told you the EKG is V-FIB. This is the EKG. So what is your first nursing action?
The heart.
Check the heart.
Yeah. Vital signs, I don't know.
Vital signs.
Yeah.
D-FIB.
D-FIB.
CPR.
CPR. What does that mean to you?
Oh, so call a code and then start CPR.
What does start CPR mean to you? Your first nursing action in CPR.
My first session CPR is check for a pulse.
Okay.
You're right.
I would say,
But just no
I'm asking her.
pulse.
Uh-huh.
I was gonna say CPR too, but I mean, I guess,
What is your first action in CPR? Because people say CPR, they don't even know what the hell they're talking about.
like mouth, not mouth to mouth, but like giving, like resuscitate them. I guess.
How? Your
Um,
actual action.
I guess, like giving them mouth to mouth. Like,
Okay, a couple breaths.
Yeah, breaths.
D-FIB. I got you already, right? D-FIB. D-FIB. What does that mean?
Chest compression.
Okay.
Yeah, chest compression.
Okay. And the little girl who was late?
Chest compression.
Okay.
Shock.
Shock.
You shot him.
Is that not D-FIB?
Yeah, they.
Oh, okay.
Chest compression. Chest compression.
Chest compression. Chest compression.
Okay, so this is why I don't let you say CPR, because her CPR was to check the heart rate. Her CPR was give a couple breaths. Her CPR was chest compressions. You were the first to say it. You are the first to win. The first nursing action is chest compressions, period. Let me explain why. I asked the question, and we're going to go back to the question. I asked the question, what do you do first when you walk in the room and the patient is in V-FIB? So why are you checking a heart rate? I told you what it was. Okay? Now, those of you who said D-FIB, you're not crazy. You're not. In fact, you were probably taught that, because I learned that. So don't get mad, but you're not crazy. But here's what I said. You walked into the room. Newsflash, you didn't walk in the room with the pedals up. You didn't walk in the room and the Zoll monitor was already there. You didn't walk in the room and the pads were on the patient. You didn't walk in the room and everything was ready for you to go. You didn't walk in the room like that. You walked in the room and the patient is in V-FIB. You can't D-FIB. You have nothing to D-FIB with. You're not that cute. You didn't come equipped with your eyeballs with AEDs inside. So think like that on the test. Watch every word, because every word on this question that I just asked you was you walked in the room. That walked in the room was important information. Okay? Okay, so again, where are you? You walked in the room. You didn't have an AED already set up. So the most efficient way you can save this life is chest compressions. And remember, everyone, when you say CPR, it's technically no longer the way you thought it was back in the day. It's not like any of those things. It's chest compressions first. Now, the other thing about chest compressions is even when you do get a defibrillator, you are still cycling with 2 cycles of chest compressions and then shock. And then back to chest compressions and then shock. Okay, they are coordinated on the patient. Okay, so this is one of the, if I'm really honest, most popular questions on NCLEX about an EKG. What do you do first with V-FIB? Please make sure you say chest compressions. Don't click on check the heart. They're not going to call a code. In real world, you would call that code, but they're not going to have that on there. They know you want to see it. They ain't going to put it on their child.
So when do you answer the field? Is it when you ask the priority question for that?
It depends on what the question is asking, because the first nursing action would not be D-FIB if they didn't say you had an AED in the room. Because what do you use to defibrillate? An AED. And if you don't have that, you can't assume. You can call for an AED to prepare to defibrillate, but before you did that, you should have done your chest compressions.
So, do we just assume because we know it's V-FIB, we're just assuming their pulses, right? That's why we don't.
Well, they told you, because they're trying to see if you understand the definition of V-FIB,
Okay.
which is there is no pulse.
Okay.
Yes, it's very different from when you walk in the room and the patient is unresponsive.
Yeah.
Then you check a pulse. But once they give you the actual EKG reading, you're done. Okay? Now, be careful. That was for V-FIB. VTAC is completely different, and it includes check the pulse first. Okay? All right now, so you did good. You passed your first test. You were able to pick this up. Now let's have a little fun. You were given practice strips in your procedures packet yesterday. I need you to find the V-FIB strip. And don't shout it out. Don't be hollering. Just find it, and I'm going to come by you and see if you're right. Don't say nothing. Yes, you poor thing. Yes, you can. Let me see. Oh my God, yeah, you need everything, girlfriend.